some cardiac symptoms, which led me to go to the ER because I thought I was having a heart attack. It was pretty much left at, this is autoimmune, we don't know what it is, but you're okay on steroids. This was before anybody knew all that much about gluten, but I started reading a lot of articles saying that if you have multiple autoimmune conditions, there's a good chance maybe you have celiac disease. So I decided to do a little experiment and go gluten-free, and within days felt so different. And that's when I was diagnosed with celiac disease. I was doing well for a few years, decided we wanted to get pregnant. I was given the okay by that cardiologist, got pregnant, and pretty immediately on knew something was very wrong. I gained a massive amount of weight. I had a lot of fluid overload. Took myself to the hospital at 21 weeks because it got so bad, and found out I was in acute heart failure. My heart condition had been misdiagnosed several years earlier, and it was actually an autoimmune condition called endomyocardial fibrosis. So the advice given to me was to abort my pregnancy at 21 weeks, which I refused to do. Stayed in the hospital from that point on, gave birth to my baby boy at 31 weeks. He's doing great now. He's 3.5. I was transplanted when he was 6 months old. So since then, I've had chronic issues. What rejection is what we're fighting in transplant, is when your body identifies your heart as something that's foreign and doesn't belong there. And it's very dangerous. It's life-threatening. So I've really made it my mission to find alternative ways besides the multiple medications that I will need to be on for the rest of my life to keep this chronic rejection down. And so I started looking at diet again. I had done AIP several years ago when I first was diagnosed with colitis and Hashimoto's. It had worked very well for me. So I decided to try it again after my last scare in April. I had another biopsy in July, and the biopsy results were completely different than they had been from April. There was no sign of any rejection, no antibodies, nothing.